Well, welcome everybody. My name is Erin Flynn. I'm the Director of Outreach at the Oregon Institute of Occupational Health Sciences at OHSU. I'm happy to welcome you to the Working Well webinar series. This is a bi-monthly webinar series that highlights the unique challenges impacting workers in Oregon and beyond. The series is designed to help safety professionals, policymakers, and experts in occupational health, safety, and well-being stay informed of the latest trends in the world of work. Working Well addresses safety and health topics from a total worker health perspective, which emphasizes hazard-free work for all, the integration of physical and psychological health in the workplace, and the design of work for optimal well-being. Working Well is a program of the Oregon Institute of Occupational Health Sciences at OHSU. We are a NIOSH Center of Excellence for Total Worker Health with an emphasis on research to practice. We invite you to visit our website to learn more about the Institute, and please feel free to reach out to the outreach team with any questions. Before we get started today, I want to note a few housekeeping items. Participants will be muted during this webinar. If you have a question during the presentation, just add them to the chat and we'll unmute you during the question period at the end. Simply raise your hand if you'd like to ask a question. If you wish to chat with other participants or share resources with one another, please use the chat feature. On the lower left of your screen, you'll find a closed caption button. Please use as needed. You'll be given the option of many language options. We want to also remind you that those who wish to receive SHRM credit for today's session can do so. We'll share the code at the end. We also offer the documentation you need for CPH and CSP credit. We are recording today's session. And then following this event today, you'll be sent an evaluation, and it would help us to inform our programs and practices if you take a moment to complete it. And with that, I'm going to turn it over to my colleague, Amy Spring.
There we go. Sorry about that. I need to get my microphone going. Is the sound working? Please confirm.
Yes, yes.
Thank you. Okay, I want to move. My slides are really not operating right, so forgive me for one moment. Okay, my name is Amy Spring. I'm the Senior Outreach and Dissemination Specialist at the Oregon Institute of Occupational Health Sciences. And before I launch today's session, I want and introduce our speakers. I wanted to just give you a sense of how we got here. In planning this event series, we consulted with a number of experts in the field. We learned from their wise counsel we learned from the wise counsel of this planning committee, and you will see them listed here. We believe the work to be done on this topic is a really important work, especially for health, safety, and well-being in the workplace, and we're happy to be a part of it and supporting the work of many of these speakers that we've had in this series. We are also able to share a few national resources with you that we've discovered that have helped us kind of think through the planning of this event. As a reminder, this is one of the events in a series that we've had. Our past events have focused on, the past events that we have had in this topic are posted on our website. The recordings of those are posted on our website. The first one was back in November. It was focused on the science of substance use and why employers should care. We heard from a leading researcher from OHSU and a program director from the National Recovery Friendly Workplace Initiative, and a leading voice from Serenity Lane, who works on support for recovery. The second event in this series happened in, sorry, the second event in this, I'm getting support here. Thank you.
Yeah.
Okay.
Just gonna edit what we're sharing. Great, okay.
Okay, so the second event in this series, which was just a few weeks ago, focused on different levels of concern and response from the employer perspective, the employee perspective, and a broader systems approach to recovery and support of people support within the community. We urge you to, if you did not attend those sessions, and are interested, they're easily accessible and free recordings on our website. I think probably my colleague Sean can put the link in the chat. Okay, now for today. We have 3 speakers that I am going to introduce now. They will bring alive some very practical examples and tools of what can be used in the workplace around focused on recovery-friendly workplaces. They will facilitate some important exchange of ideas and resources amongst the participants as well. So this is meant to be a very practical and interactive session for us today. So let me just turn to the speakers. What I'm going to do is just briefly introduce everyone, and of course point you to our website for a full bio for each of these speakers. And then I'm going to turn it over to them, and I'm going to leave the stage. So I'm going to start with Claire Bryant. She's a speaker who brings a public health lens to one of the most important, pressing and challenges facing workplaces today. Claire's a certified health education specialist who works in workplace well-being and initiatives in the National Safety Council. She designs, implements, and evaluates programs focused on substance misuse, fatigue, and other workplace safety risks. Brett Lovins has spent over a decade working on the intersection of recovery and the workplace, a person in long-term recovery since 2013. Brett founded Sober Curious Consulting after launching one of the Cisco Systems' most impactful employee resource groups that help to reshape how large corporate events are planned and run. And finally, David Shapiro. He's a nationally recognized leader at the intersection of workplace health and recovery. David's work was the inspiration for this series that we have brought in the three events that I just described to you. He serves as the Assistant Director of Programs and Partnerships at the Center for Health, Work and Environment at the Colorado School of Public Health. He leads Health Links and the Recovery Friendly Workplace Initiative. Two of these two programs that help employers across high-risk industries build healthier, safer, and more supportive workplaces. His current research examines how workplace factors like job autonomy and organizational support shape well-being and retention for employees in recovery. So help me welcome these speakers, and I'm going to turn it directly to Claire.
All right, thank you, Amy. I'm going to go ahead and share my slides. So just give me one.
Let me stop sharing. There we go.
All right, can you guys see my slides okay?
We can,
All
Claire.
right, perfect. Well, it's so awesome to be with you all today. Thank you for the time and just the attention to this important topic. I manage the workplace well-being efforts at the National Safety Council, and we've been involved in this program area since 2012, particularly as it relates to addressing the overdose crisis. And it's so exciting to see that this is the point in time that we're in so that we can move all of our policies and programs related to substance misuse into this recovery supportive framework as an emerging best practice to really complement the existing drug-free workplace programs that many employers already have. If you're not familiar with the National Safety Council, we've been around for over 100 years, and we focus on safety both through the workplace and through the roadway. We are a member organization, so we've got about 13,000 member companies that engage with us. So while we work to support all of those companies, we're also looking to continuously engage in emerging best practices and research on topics that are impacting safety across the board. And so one of these areas is our workplace well-being program, and that's where I sit within NSC. And we really look to help to create resources and programs for organizations that are looking at improving their safety programs by really connecting in well-being related risk into those safety management systems by using a total worker health perspective and framework in doing so. And so you can see some of the topics on the slide that our program really focuses on, including things like impairment and fitness for duty, of course, substance use and overdose, mental health, fatigue, psychological safety, and other topics, including workplace violence as well. And so throughout all of this work, one of the threads that's been the most consistent for me in particular is all of our work on substance use harm prevention. So that's an area that I'm extremely passionate about, and I'm again excited to see that we're focusing on these recovery supportive practices, and there's momentum in this space in particular. And I'm not going to talk about the key initiatives and resources we have just yet, but I will share at the end of my time with you all just a few tools that we have that are free on our website that you can take advantage of in terms of building these types of programs. But for now, I'd like to really start and take a step back on implementation. That's what we're focused here on today, on how we can actually build programs that utilize this recovery supportive framework. So I'm going to provide a high-level overview of just some ways to get started, and then we're going to dig into a tool that we have at the National Safety Council to help build in your assessment, and then we're going to hear from Brett and David to really get into the nuts and bolts on some of these program considerations. So again, taking a step back, when we're building programs to address any well-being related risk in the workplace, it's really important to consider both the upstream and the downstream factors and resources that your organization can provide in order to really create a robust program within your organization. So what that looks like is not only making sure that you have access to treatment, for example, but you're also doing preventative activities, and you're also thinking about early intervention, recovery, and return to work. So you can utilize this framework to really take a step back and look at the resources that you have to make sure they're not all lumped into one singular bucket. And I think this also really complements the Department of Labor's Recovery Ready Toolkit, which is a fabulous resource. If that hasn't come up yet, I encourage you to check that out. There's 4 key areas that toolkit recommends for programming to be focused on, and that's prevention and risk reduction, training and education, hiring and employment, and treatment and recovery support. Those kind of mirror a lot of what you see on this chart, and these provide some examples of some areas that you might want to dig into further to build out your programs. So while we're thinking about both the upstream and the downstream interventions that our organizations can be really providing programming around, I'm sure all of you are familiar with the total worker health hierarchy of controls. So we also want to evaluate the resources that we're building and the systems that we're creating to make sure they're having the most impact on the entirety of our worker population. And I put some examples here within the total worker health hierarchy of controls related to some considerations regarding recovery supportive practices. So of course, the most effective kinds of solutions that you can look at are focused on the elimination area of the pyramid. So for example, you could remove common triggers for workplace stress. So that could include looking at removing alcohol, for example, from company-wide events to remove that trigger for all of your organization. On the flip side, it's also important to be providing education. We all know that. It's not the only thing that an organization should be doing, but it's absolutely an important pillar of creating recovery supportive programs. So you could be investing in trainings related to anti-stigma messaging, trainings on reasonable cause training, and really focusing on a person-first approach and something that is trauma informed. So those are all kind of avenues that you can look at to build programs. And it's hopefully helpful to think about these broader approaches in terms of how you're evaluating the resources that you have, so that you can make sure that your program is robust and comprehensive, knowing that it will take a lot of time and there will be a lot of baby steps taken to get through all of these different opportunities to build the programs. So taking a further step back, before we get into what actually the kinds of programmatic elements that we will include for recovery supportive practices, we want to go back to our tried and true implementation models. So that is looking at our Plan, Do, Check, Act model, or maybe the workplace health model from the CDC, if that's your preference. And most of these really start with a planning and implementation assessment, planning and assessment component of these models. And so what I'd like to do to kind of tee up what Brett and David are going to share in more detail is to start by utilizing our substance use cost calculator to help with your organization's risk assessment. If you are not familiar with this tool, it's a resource that we launched in 2017 and then further updated in 2020 to really help to put some numbers behind this issue, to help give organizations a tool to really build in organizational buy-in and also to understand the breadth of the impact of substance use disorder and the power that recovery can have on organizations. So you've heard from the rest of the webinars in the series, if you've been participating, on just how wide and broad sweeping this issue is, but this will give you some numbers that you can consider for your own organization based on data primarily from the National Survey on Drug Use and Health. So I'm going to go through a little bit of a demo of the tool. I cheated and I took some screenshots of the tool. I wasn't sure if technology was going to cooperate with me. So I encourage you to go to the vanity link that's on the slide, nsc.org/drugs-at-work, so that you can follow along with me while I go through the demo to figure out what this actually looks like within your organization. And hopefully it will give you some numbers and some information that you can bring back to your teams to have more conversations about either building recovery supportive practices or expanding practices that you might already have in place. So I'm going to dig into the tool itself. What you'll see when you go to the home page is that you will have some fields that you can input your specific information into. So you'll have to add in where your facilities are located, how many employees are in your organization, and then what industry you're in. You can also add additional states. So if you have operations across states, you can add those in, which is great. And for this hypothetical example, I used Oregon as the state with 500 employees in the industry of construction. And then you simply input your email and then you get those results both on the web page and then sent to your inbox as well. And I promise we will not spam you. So these are the high-level costs that this hypothetical organization would expect to see on an annual basis. Keep in mind, and these are also 2020 numbers, and so you would also anticipate seeing likely larger numbers with dollars and cents that are specific to 2026. So this organization would expect to see over $1 million in cost related to the impact of substance use disorder within their organization. And so the way this is broken down is in 3 primary categories: in lost time, job turnover, and retraining, and also healthcare utilization. And so when you click that bottom button in the corner of this component of the tool that says expand cost detail, you will see a lot more specifics on how these numbers really add up into those total costs. So it's broken down into excess days missed annually, excess annual turnover, excess annual healthcare use, and excess roadway risk. So there's a lot of information in here you can use. You certainly don't have to utilize all of it, but we really tried to make clear within the tool itself where these numbers are coming from. And then there is also a feature on all of the different buckets of the tool outputs that says learn more or something similar. And it will show you how each of those specific components was calculated. We do have a methodology report that I'm happy to share as well. So moving along in the rest of the results for this organization, you can see that about 101 employees are impacted by substance use disorder within the organization. And that is calculated by state and also industry risk as well. And then including the dependents and family, which is a really important consideration for the impact that an organization's program can have, is how far-reaching some of those tentacles can stretch to impact the families that are participating in benefits that a program might offer. You can also see the specific substances that are likely impacting individuals within the organization. So it's not surprising to see that the highest proportion of substance use disorders predicted for this hypothetical organization is with alcohol and alcohol use disorder. But then you can also see the impact of opioid use disorder, cannabis, and other drugs as well. And so at the end of the day, one of the most powerful components of this tool is the demonstration on the positive ROI of supporting individuals into recovery. And so while we want to make the case and bring forward the positive impacts on well-being within an organization and the positive safety impacts as well, sometimes dollars speak louder than words. So this is a great way to help make that case if that's where you might be getting stuck in your organization on getting buy-in. So through this research to create the tool, we found that each employee who recovers from a substance use disorder actually saves a company over $8,500 on average. And in general, those costs are really helping us, are really built up by looking at less healthcare utilization, really less days missed in work, and other considerations that really help to make that case for building recovery supportive practices. And then also, this is a simple slider that is something that you can utilize within the tool itself that shows the more % of your employee population that you're engaging in recovery supportive practices, the higher amount of cost that will be avoided by connecting employees to care and to programs within the organization. So lots of numbers that you can use and lots of talking points that you can take from this tool. We do also have some methodology briefs and issue briefs that break this down by different subject matter areas if you're interested in looking at more of the data that we have, because there's, I think, about 8 different reports that we have related to all the findings from this research that I obviously won't get into the depth of those today, but I'm happy to share links. So really just breaking this down, there's such a huge opportunity for connection to care that organizations have. They're at the center point of opportunity to really improve safety, but also to connect employees to the resources and support that's needed. So that benefits safety, it benefits costs, and it benefits the employee well-being. So it's really a helpful business case to be able to utilize to draw support, and also again to use this as a risk assessment tool to say there's likely a high proportion of our employee population that is dealing with substance use disorder and their loved ones. So how can we connect resources that are going to be the most useful to that group and make sure that we have the appropriate amount of resources and solutions that can help address the issue within the organization. And of course, from a safety perspective, this is incredibly important, making sure that we're having workers arrive to work fit for duty, and there's resources to support them if they're not in a place where that's going to be possible, where they can ask for an accommodation, where they can ask for access to treatment, and they can come back to work super motivated to jump right back in there and also to be safe at the same time. We've done a lot of other research in this topic area, and I did want to highlight one finding from another survey that we did recently on naloxone in recovery. And we surveyed employers and employees. And in this survey, we found that 79% of employees agreed that they would be more likely to work for an employer that provides resources related to substance use. So we know this is a benefit offering that employees are also asking for, and it can provide a competitive advantage to organizations that are able to offer benefits that help address substance use disorder and promote recovery. So I do just want to highlight some of the resources that NSC has to offer before I hand the mic over to Brett and David to really get into the granularities of what some of these programs can look like within organizations. The first being the Workplace Wellbeing Hub, which is the vanity link that you see listed on the slide, and I can of course put some links into the chat after I'm done speaking. This is really our one-stop shop for implementation tools for safety professionals to address any well-being related risk. We did just do a really big launch of substance use and mental health related tools and resources, such as Talk to Your EAP scripts and a crisis intervention guide. Lots of good stuff in there, and it's mostly available for free, so I highly encourage you to check that out. We also have a tool called our Overdose Emergency Planning Tool, and that is a new resource that was launched in the fall of this year to really help to provide more specific estimations for organizations to understand how many doses of naloxone are recommended in providing to their organization based on research. So we have that tool available for free on our website, and while it gives you those estimations, it also helps to walk you through some steps that you can consider to build your program to make sure that you have naloxone as a component of your first aid or emergency preparedness efforts. Another resource that I'd like to highlight is our Connect to Prevent program, and that's a free training that we have that is an email-based training that is something that can be used to send to employees who are parents or are caregivers of teens or young adults to really help to have effective conversations about substance misuse, and taking a harm reduction oriented approach and having those conversations and building trust. We did a lot of research with teens to figure out the best way to really engage with them on this topic, and we were able to embed that in motivational interviewing concepts into the training. I think it's a really valuable resource that employees have enjoyed engaging with to make sure that they're able to open up and have more conversations at home about a kind of a tough topic area for many. We also have our impairment recognition and response training for supervisors. So that's a reasonable cause course that we have really to help expand the definition of what impairment is. So while most folks associate potential impairment at work with substance use, like we're talking about today, there's many things that can impact fitness for duty, including fatigue, mental distress, even certain medical conditions. Can impact our ability to perform, and to really help supervisors understand how to connect employees to care and recognize that initial risk to make sure that we're protecting safety on the job. And then lastly here, I just want to highlight that we have a relationship with U-Turn Health. They're a fabulous partner and resource, particularly for this area. They provide a lot of education, and they have peer support models that you can utilize if you're looking to integrate that into the organization. I highly recommend looking at their site and some of the resources that they have. So that was a very quick overview. I've got my email listed on the slide, and I'll put it in the chat as well in case you have any specific questions about our resources, but I think we're saving questions for the end. So I will go ahead and turn the floor over to Brett and David. Thank you all for the time.
Thanks, Claire. I just want to make sure everybody can hear me okay. Audio is working good.
Sounds great.
Fine, perfect.
Great. Just looking for my presentation. Hi, everyone. Nice to see you today. My name is David Shapiro. I use he, him pronouns, and I work at the Centers for Health, Work, and Environment at the Colorado School of Public Health. And I am a person in recovery. And what that means to me is I no longer use cannabis. I'm abstinent from all psychoactive substances except for those that are prescribed, and I use them as prescribed. But after an over 30-year relationship with cannabis, I'm happy to say that for the last 12 months plus and a few days, cannabis is no longer part of my life, and that's what recovery means to me. So today, my charge is to talk to you all a little bit about the Recovery Friendly Workplace Initiative that I have the privilege and honor of running for the state of Colorado. It's something that I've been working on since 2021 as part of a larger total worker health approach. So I know many of you know Oregon and even our work at the Centers for Health, Work, and Environment from the total worker health conversation and domain. We have embedded Recovery Friendly Workplace Initiative within our total worker health strategies. And it really came out of a conversation in COVID about supporting worker mental health. When we started to talk more and more about supporting workers and their mental health experience in the workplace, we started to hear more stories about how psychoactive substances, how impairment and recovery was impacting the workplace. And that really started in late 2020 and early 2021. It's important to recognize that recovery is a broad term as we get started. You may have covered this in session one, but I like to level set when I can. SAMHSA, the Substance Abuse Mental Health Systems Administration, defines recovery as a process of change individually directed, where individuals lead self-directed lives towards their full potential health and well-being. It's a really broad definition intentionally. Excuse me. SAMHSA wants everyone to be able to see themselves as under the tent and under the definition of recovery. As a researcher and scientist, though, that makes things a little bit difficult because Brett's definition of recovery may be very different from what mine means. And so as I've talked to a lot of human resource managers and human resource professionals, small business owners, it becomes tricky as well because some versions of recovery include maybe 24 hours abstinent or sober from a substance, and others maybe 12 months or longer. And with that broad variety of definitions, and others may be using certain psychoactive substances to minimize or reduce harm versus stronger and more difficult ones to get off of. And so all of those fit within the recovery experience, which does make a one-size-fits-all approach challenging. And that can be hard for human resource professionals, safety managers. So I just want to acknowledge that as we start out. We define a recovery-friendly workplace as an organization, as an employer that actively supports people in recovery and recognizes that people in recovery have a lot of assets and strengths, just like a number of members from a diverse background in your workplace. The fact is, as Brett mentioned on the first webinar, people in recovery like myself are already here in the workplace. There's a lot of individuals that are experiencing substance use disorder, and they're already here in the workplace as well. my hope is that we can understand substance use disorder as a medical condition like it is, and we can provide the same type of supports that we do for individuals with other chronic medical conditions like cancer, cardiovascular disease, type 2 diabetes. And what I've known working on, or what I've seen, witnessed working on health promotion and health protection over the past 8 years at the centers, is companies and employees and employers in general seem to have a playbook for how they're going to approach cancer supportive workplaces or type 2 diabetes or cardiovascular disease. There's a set standard that we kind of operate under when one of those chronic medical conditions is what individuals face. In the couple hundred conversations I've had with employers around supporting people in recovery, I haven't found that there's any standardized toolkit or conversation about how to approach substance use disorder and people in recovery. It's a different conversation for whatever reason, and we're not going to get into some of those behavioral health elements today. But our hope is that more and more employers start to recognize that A, people in recovery are already in the workplace, and B, that substance use disorder is a medical condition that can be treated and approached in the workplace just like any of the other chronic medical conditions. Let me see if I can advance here. Great. It's important to start talking about policies, practices, and programs, right? And so when we talk about what does a recovery-friendly workplace look like, and that's my charge for today, I usually bucket things under policies, programs, and practices. And the first policy I need to mention is, can an individual in recovery even get the job? If you can't get the job, it's hard to be in a recovery-friendly workplace. And so fair chance hiring is something that's really important for workplaces to better understand. You know, when we look at background check hiring information, not all companies are created equally. There is a number of individuals that have experienced a felony conviction for substance use or substance distribution, and they may or may not be able to get the job at all. And so when we're talking about policies, I think this is the first one we need to just have a conversation about and consider. It is important for companies to evaluate their hiring practices, their background check policies, to determine if they're a barrier for people to get the job, and is that really necessary or not. And so as we start our conversation about policies, and we're going to talk about a lot more policies in just a moment, the first one I want companies and individuals to start thinking about is, well, can someone who has a background in substance use, and for those of us that are part of the recovery community, and maybe you've heard this before, if you have a felony conviction for substance use, more than likely you're going to have a felony conviction for substance distribution as well. It's just kind of, they go together in the felony criminal environment. And that can really prevent someone from being able to get a job. And whether or not that's necessary is up to the company and up to the Total Worker Health Centers, and when they're working with companies, to decide if that's actually the policy that should be followed and for what reason. A common practice, and the Oregon team and Amy and others have heard me talk about language several times. And so we've talked about policies just briefly, and we're going to touch more on it. Here's a practice, and that's using person-first language. So this comes out of NIDA, the National Institute for Drug Abuse. How do we use person-centered language when we're talking about individuals who have experienced substance use disorder, right? And so there's a whole chart on person-first language. We're hopefully familiar with this type of language for individuals experiencing homelessness. I'm David, a person in recovery. I'm not David, an addict. I'm not defined by my condition. I'm not David, heroin wasn't my thing, but I'm not David, a junkie. I'm not David, an alcoholic. It's a moment in time, and it's really someone who has experienced something rather than a definition of my character. And that's kind of what this entire chart talks about, right? Using person with substance use disorder instead of an addict or a junkie, using person with an alcohol use disorder instead of an alcoholic or a drunk. And the reasons are, we're therefore recognizing substance use disorder as an illness. And this is a shift we can all make. We can make this in our personal lives. We can make this in the workplace. There's a number of recommendations here, right? Instead of a dirty drug test or even failing a drug test, testing positive or even testing non-negative. But we're looking at more fair practices here when we're talking about some of these language shifts in order to raise awareness and to reduce stigma. Here, instead of saying abuse, it would be use or misuse. And there's a lot of state and federal government entities that need to look at the word abuse to decide if that's really the word that it should be used, or if we're ready to move into use and misuse. And a good example of that is our partner in some of this work on the Anschutz Medical Campus at the University of Colorado was the Colorado Consortium for Prescription Drug Abuse. It's a long phrase, Colorado Consortium for Prescription Drug Abuse forever. They've shifted the word abuse to misuse. So now they are the Colorado Consortium for Prescription Drug Misuse. abuse has negative connotations and judgment assigned to it. Use, misuse has less, right? And so, so this chart is available, and these slides I've shared with the Oregon team if you want to look them up. But again, this is all from NIDA and is available to you online as well. So let's talk more broadly about policies, practices, and programs. There's a number of elements that create positive work conditions, and they're kind of listed in these bubbles here on the screen if you're able to access the screen, from accommodations like flexible scheduling all the way through culture like empathy, honesty, and understanding, and how we communicate about things. It's important to remember that most people with a substance use disorder recover. The statistic that is at the top of the screen here is from 2020, indicating that 75% of individuals recover from addiction. I think that number is closer to 80% now, with treatment, with therapy, with a variety of, perhaps medication management. But the reality is most people recover. And so not only are we already in the workplace, but individuals who are currently experiencing substance use disorder are going to be individuals in recovery soon. And so, again, here's a spectrum of positive work conditions, what type of benefits a company offers that goes under programs, what's your medical plan, how does it cover substance use disorder, what's your paid sick leave program, are people able to access family leave and paid FMLA or not, and then how do we communicate, how do we use person-first language. So all of these are examples of policies, practices, and programs that help an organization move towards being recovery-centric or recovery-friendly. Just a couple practical examples, having access to employee assistance programs or other mental health services, inpatient treatment, substance use disorder services is important. Having open communication builds trust. So when I talk about my own experience, that may open up the door for other individuals to disclose and talk about what their experience looks like as well. It doesn't happen without a leader speaking up. So expecting team members and individuals who are in frontline or essential positions to talk about their own experience with substances without middle management, supervisors, and leaders talking about it is probably too far of a reach. But it does start to happen when owner operators, small business directors, individuals with leadership positions start speaking about their own experience. That kind of creates an environment where everybody else in the workplace starts feeling comfortable speaking up as well. And maybe this is a good place for me to pause and pitch it over to my friend Brett to see if he has anything to add about communication and ways in which disclosure can go in a workplace. Is this something that Soberforce dealt with? We always get questions about disclosure. How did leadership approach it? And what are some of your thoughts about if someone's willing to start talking about it? What would a company need to have in place to make an environment where it's more comfortable to do so?
Well, thanks for asking, David. And I can only speak from the lens of what I saw. And so we went from zero talking about it to quite a bit. And one of the first things that happened that was really encouraging is we had what's called an ERG, or Employee Resource Group, that stood up, called Sober Curious Consulting. And in my case, I went from knowing nobody in recovery to like a lot of people in recovery real fast. And right away, we started collaborating with other ERGs. So in our case, Women at Cisco and Sober Curious at Cisco had a webinar together where we discussed the effects of alcohol in particular on women's bodies as opposed to just men's. And that was a huge win, because now all of a sudden, this topic has a way of being kind of everywhere, even though we talk about it as sort of a kind of a one-off, and not always, but when you have those opportunities in the workplace where you can coordinate with other organizations, that worked really well. And one of the first webinars shortly after that in the women's group was around a woman who shared her whole story about being at Cisco, asking for help, sharing how she went through the process, and at the end, how she's been a great member of the team for, I think she was 5 or 6 years sober at that point. And for people that were on the call, the chat was lighting up, because it was a clear example that the company was ready to help her, that the mechanisms were in place, she leveraged them, and she got promoted, etc. So those kind of single one-off stories within an organization really can have a lot of impact, and from my vantage point. And so once you kind of open the gates, this kind of communication sort of blossoms with people coming forward to share some of their stories. So that's what I'll add to your question, David. Thank you.
Love that, Brett. Thanks so much. I mean, the power of storytelling, especially in this space. I mean, there's always power in storytelling, but the power of storytelling in this space on a topic that we just don't talk about very much really can have a lot of impact. And the more people can see themselves in the people sharing the stories or their own experiences, the better. And what I loved about what Brett shared is it touches on so many elements of positive work conditions, right? It talked about the open communication. You have to have a lot of psychological safety and security to feel comfortable in that environment of speaking up. Obviously, the culture was inclusive, right? They were encouraging people to share their stories. They were providing helpful resources like the employee resource group. People were being treated fairly and able to even professionally advance, and the individual was recognized and rewarded or recognized to some degree for sharing their story. There was shout outs and excitement and enthusiasm over shedding light on something that's normally in the dark. And so the positive aspects of shifting language and storytelling, if you're truly in a culture where that's able to be done, touches on so many elements of positive work conditions. I think that's one of the things my background is in anthropology, and some of you have heard me say I used to think that I had to travel overseas to study culture, but as we all know, in the total worker health domain, culture is right here in the workplace. And this culture around supporting people with chronic medical conditions, especially people with substance use disorder, is really rich with stories, with support networks and social support, with a variety of things for us to either study as researchers and academicians or for us to practice as employees, HR professionals in the workplace. So, here we're talking more about organizational support. I've already talked about policies, practices, and programs, making sure policies are clear and that they align with how the company actually carries out the policy is really important. And we're going to touch on that in just a moment. Having well-defined steps around disclosure, because this is something that often comes up in conversations around this topic. When I bring the recovery-friendly workplace topic to a group of employers or to an individual employer themselves, there's usually two things that come up after the conversation. The first one is, how do we handle active psychoactive substance use on the job? Impairment. And that's a really important thing to be more aware of is, psychoactive substances are being used on the job, and in some industries more so than others. And so even though we want to work with people in recovery, first we may need to do the intervention of individuals that are actively using substances. And so that often comes up. How do we handle that scenario? And the other one is really around disclosure. And it's something that, I've had a lot of practice having conversations one-on-one with or with companies about. And it's hard. This is not an easy conversation for somebody to bring up. There's a lot of stigma. There's a lot of shame that goes along with being in recovery. And what I normally tell individuals is twofold. One is if the organization has an ADA coordinator, an Americans with Disabilities Act person, that might be the first person to talk to if your organization is large enough, because they're always a safe space unless there's a couple things you disclose which are not substance use related, to find out the process. So that's one thing, is see if you have an ADA coordinator in your workplace. And the second one, and we know this in the recovery community pretty well, is if you're worried about sharing about yourself, ask on behalf of a friend whether or not that friend is real or not, right? Say, I have a friend who I think might be experiencing this, and I'm just curious what some of our policies are, right? And so that's one way to get at what's going on without having to do self-disclosure, and just sort of explore and find out more information. But it's about being open and honest, and not every workplace is created equally, and I understand it can be difficult to even ask the question. I mentioned this, and Brett, I'm going to turn this back over to you in just a moment when we talk about leadership here. This does not happen without the support and buy-in of executive leadership. And it's one thing for leaders to say, we're going to do this, here's the ERG. It's another thing to build communications around it, for leaders to step up and show support. My guess is at Cisco Systems, there was leadership buy-in and support. I'm curious about how that looked like. But as much as we want this to be a grassroots initiative, and it's coming from employees that want these supports, it's also a grass tops initiative, right? This does not happen solely from frontline and essential employees. There's got to be buy-in from executive leadership, and it has to be public buy-in. It can't just be covert, like we're okay doing it, but we're not really okay doing it. And we've seen that, that sort of same strategy deployed in a number of other areas where companies have had campaigns to support mental health, to support neurodivergent workers, to support various chronic health conditions or various exercise and health and well-being strategies. Brett, I'm curious if you've seen some executives, whether it be at Cisco or in other companies you've worked with, that really have shown up and shown commitment as an executive doing this work, because I know it's a really important component of the work. I've got a few in my network, but I'd love to hear more about your work with leaders specifically.
Well, I'm going to tell the truth on this one. It took a while to get people higher up at Cisco to buy into this concept. And I'm just going to share that from a grassroots level. If somebody's on this call that's, getting fired up to do this work, it might be, I don't know if the word lonely is right, but you could be kind of a lone worker on that for a while until you can build the kinds of trust and the kinds of knowledge for people to understand sort of how this thing works. So in our case, we kind of put the cart before the horse. So we had stood it up at a grassroots level before we got our only executive sponsor. And that was way late in the game. It was like we'd been up and running for a year and a half. And then we, basically I was on a call and happened to be asked the right question of an executive VP and our senior vice president. And here's the thing, this stuff runs through families, and most people haven't experience with it, and it surfaced something for her, and it was just the two of us. And she signed up to be our executive sponsor. So they're in, to David's point earlier, we're everywhere. But let me throw this back to you, David. My understanding for most of the statewide recovery-friendly workplace certifications, like first checkbox is getting buy-in from top brass at any particular company. And I think that's on purpose. Is that a reasonable one to throw back to you on that topic? Because I think it's important. Yeah.
Thanks, Brett, for the question and for that experience. And I think you're talking about a moment in time with your experience that's actually really relevant and happens a lot today. I actually think we live in an environment right now where without executive and leadership buy-in, almost from the outset, it's hard for the program to sustain itself because we're not in as flexible an environment maybe as we used to be, and with some of the stuff that you had coming out. And with some of these topics where there's like legal concerns potentially as well, to have it expected going from the grassroots and not getting some sort of executive buy-in might be difficult. It's not impossible. And you're right that with certification, the first step to get certified and recognized as a recovery-friendly workplace in Colorado is signing a letter of a commitment or a pledge. And we ensure that whoever is signing that is a decision maker at the organization. And if an essential employee signed it, we say that's great. We're going to wait to put your name on the list of participating companies until we get the buy-in from executive leadership, because there's a number of other steps that these companies are going to have to go through. And as much as we want to support and we're willing to have conversation with individuals who are not in decision-making roles, we really are going to need the buy-in and support of someone in a leadership position in order to move forward with the rest of the components of the certification. And so having a decision maker sign on from the beginning in order to get recognized or certified as a recovery-friendly workplace is kind of it's a basic right now, a foundation of the whole experience. Because we've had experiences in the past, and maybe some of you that work in health and safety have seen this as well, where you get pretty far down the road on a new well-being or a new safety initiative, but it turns out, well, nobody really checked in with the supervisors, managers on whether or not this was the strategy the company was planning on going down. And actually that can create more problems. Like I've been in scenarios where the lack of buy-in from leadership around a safety sensitive topic actually turns the company away from some safety related things that would be good more broadly, just because of the defensiveness that happens. And we would hate to set a company even further back by having it launch with a number of essential employees, but not do the buy-in from leadership, and then them say, well, we never want to do recovery because of how it launched, right? So if we can launch the thing with the right solid foundation, even if it takes a long time, like Brett was saying, I think we have longer term legs and sustainability by getting the right team to buy in. It's kind of a classic total worker health strategy, right? For those of us on the call, you make sure you get a variety of team members involved in the initiative at the outset, so that there's long-term sustainability in the program. We've already mentioned things like EAPs, employee assistance programs, and a new deliverable for our initiative is specifically setting up ERGs, employee resource groups, like Brett had talked about at Cisco. We have one at the University of Colorado. Salesforce's SoberForce is another one. Really, these are just like other employee resource groups that can be race or gender or sexuality oriented. We're launching recovery-friendly employee resource groups in a number of employers throughout Colorado. I'm happy to talk more with you all about that deliverable. It's a new objective that sort of expands on certification, where we're doing this sort of deeper level of support within workplaces, where we're pairing a trained peer support specialist to go in for 12 to 18 months and help train internal champions to sustain the group long term. So we have some funding to support someone who does this work in a peer setting, but taking them into a utilities company or into a social services agency or a bank even, to launch the group internally, or in an industry like forklift operators have shown some interest. And then from that, there'd be an internal champion that would sustain the group long term. So these resource groups are going to be a strategy we continue to develop over the next few years in Colorado. I'd be remiss if I didn't at least mention a number of federal and state policies that touch on individuals that are affected by substance use disorder, right? So they're listed here on the screen. You're probably familiar with some of these, maybe not all of them, but the Equal Employment Opportunity Commission, EEOC, that enforces the laws that prevent employment discrimination. They protect employees from unfair treatment, harassment, denial of reasonable accommodations. So this is what protects us in terms of disclosure from when we are going to get the job, and also a little bit with once we have the job. But the big one is once we're on the job site is the Americans with Disabilities Act. I like to say on this conversation, disclosing that you have a substance use disorder or a mental health condition or any chronic medical condition is a two-way conversation. It requires the honesty and vulnerability on behalf of the individual, raising their hand and saying, this is something I have and I may or may not need accommodations for. And then the employers have to act, because substance use disorder, alcohol use disorder, and opioid use disorder, all substances are covered under the Americans with Disabilities Act. Now, there's some important caveats in there. Someone can't be actively using psychoactive substances illegally in order to be protected under the Americans with Disabilities Act. So, there's some legal conversations around that. But for people that feel comfortable with their recovery and their sobriety, we do have protections under the ADA. Obviously, there's FMLA, the Family Medical Leave Act, which is job protection for individuals with unpaid leave. Many states now have paid family and medical leave. In Colorado, we have the Family Act, FAMLI, which is paid leave for chronic health conditions of your own or one of your dependents. We're probably familiar with COBRA. After leaving a job, you still can have access to medical plans and other benefits. The Affordable Care Act, I'm sure we've heard quite a bit. That's where medical plans and healthcare insurance are mandated for companies over 50 employees. These last two are actually quite relevant in the conversation around recovery. One is the U.S. Drug-Free Workplace Act of 1988. For those of you that aren't familiar with it, any organization or any employer that receive federal funds is required to have a drug-free workplace policy and to have some training on it annually. Now, a lot of those policies that I see were written in 1988 or 1990 and may not have been adjusted much since then. And so they require a look over and they require some analysis on, is this still the policy we live by, or what we actually practice in the workplace? I will say in Colorado, with the passage of legal marijuana, a lot of those Drug-Free Workplace Act policies were revisited specifically to talk about cannabis and marijuana, but they still have policy work, and policy review is something that we do at our centers frequently in partnership with organizations. And we have a library of recovery-friendly worded drug-free workplace policies. And then finally, for anybody that's part of a Department of Transportation job, OTETA is an important one to note. If you're part of a long-haul trucking or the aviation industry, this is the act that allows for and requires random drug testing for people with Department of Transportation licenses, whether that be in the air or on the ground. And so OTETA and the testing that goes along with it is an important one to recognize if you have anybody with commercial driver's license. When we talk about supporting people in recovery, and we're wrapping up here with just a few more slides before we get into our breakout sessions, it's all about creating a supportive environment by encouraging open communication while also respecting privacy. And in my mind, it's, I don't know if it's stricter is the right word, but applying relevant substance use policies and cultural shifts within the organization. I hearken back to policy because I feel like workplace policy is one area, in addition to language, where we can make some shifts that would impact the broadest amount of people. If the policy shifts from a zero tolerance policy to one that is more supportive of individual in recovery, not only is the company protected from on-site psychoactive use or impairment, because oftentimes the policy will include still termination as a possibility. It just won't lead with that. And now a lot of companies aren't leading with termination anyway. They're leading with care and support. And then if termination is something that's necessary because a person has had a number of chances, well, then that is still part of the policy. It's just not the sole focus or the beginning of the policy. And so shifts in how policies are worded, how they're described to employees is another area that I think is really important in this domain, and especially getting out from underneath complete zero tolerance policies. You do have to balance policies with safety. And a number of organizations, when we launched the initiative, asked me, it hasn't happened recently, but asked me in the beginning, David, can we still fire someone who's impaired on the job and be considered a recovery-friendly workplace? The answer is absolutely yes, right? The hope is that person gets support for their addiction, for their disease. But the reality is, especially in safety-sensitive industries, safety has to come first. The safety of the individual, the safety of the other employees, and the safety of the community. So there are certainly times where termination may be necessary. My hope is it's just not the lead. It's not the first thing that a company considers. That the company considers someone with active addiction like they would a family member, a neighbor, a friend, and get them the help and support they need, we need, and then talk about what the implications are on employment, including and up to termination. So being clear about the policies, making sure that everybody understands what the policy is often the first conversation we have with a number of organizations, especially ones that are in safety-sensitive sectors. I just want to close with the assets that recovery-friendly workplaces contain or are. Normally, individuals in recovery, when we've gotten to the other side of our recovery, are quite trustworthy and quite adamant about safety practices and principles. That we generally have lower absenteeism rates. We miss less work on average than the general workforce. And ultimately, can be more productive and healthier because we get such an amount of recovery capital from the workplace. When you look at the Venn diagram that's recovery capital, there's so many elements of recovery capital that are part of an individual's life who is in recovery, right? There's social support, there's financial benefits, there's identity and structure, there's medical plans and benefits. And so oftentimes, if we can find a job that fulfills that role for us, that need, an individual in recovery is a really solid and stable employee. So it's a benefit to the company not only to hire people in recovery, but also to support their current employees into getting into successful recovery. And so the goal is building stronger teams, improving morale, raising awareness, and ultimately reducing stigma. With that, I'm going to turn it back over to the OHSU team. I'm so grateful for the opportunity to speak with you all today. Thanks for letting me run through some of the work that we do in Colorado, and I'm happy to connect with folks about it either in the break rooms or after the conversation as well.
Thank you all so much for your amazing wisdom and really outstanding slides. So, okay, the next thing we're going to do is we're going to turn our attention to some small group discussions. And these experts are going to be facilitators of these discussions. So basically, we're just going to spend a little time in small groups with the hopes of generating some applicable ideas among the people who are here, and then come back and bring forth some questions that emerge from the small group or some ideas that sort of surfaced as salient in the small group discussions. So I'm going to turn, the facilitator will take a few notes and be prepared to give a very brief report out, but we'll probably spend about 15 minutes in this discussion groups and then we'll come back. So I'll ask Sarah to send us there. So with the last 15 minutes that we have together, I'd like to just regroup. So David, we had some, I guess I would like to invite people to ask questions of the panelists right now. Let's just use this time to at least take advantage of these speakers, and to the extent that we have questions to dig deeper on, let's use our time to do that.
Do you want people to type their questions into the chat, or will they be able to say them out loud? How can people ask questions?
I think Sarah has given them the capacity to unmute themselves so they can ask them in the chat or can unmute themselves. Either way.
And I just saw a notification come up that says you can unmute yourself now. So I think that capability hopefully is in effect.
Stand back.
It sounds like you can unmute yourself and just announce who you are and maybe where you're calling in from so we have a clue.
Still can't unmute Sarah. Sarah.
Kate Wood can. Whoever Kate Wood is, she's unmuted. Hello, Kate.
Oh, am I here? I'm
Yes,
sorry.
you are. Welcome aboard.
I'm just writing in a chat to you. I'm curious about problem gambling, and particularly in terms of how easy the access is with the like Polymark or Cashly or all these low cost gambling opportunities on cell phones. And how does problem gambling fit into, it's not a substance, but clearly it has some of the same brain responses that substances do for some people. And is that being looked at or addressed in the programs that you're promoting? Oh, and if the question is around why, from a workplace standpoint, my experience from a risk management perspective was that when you found a trusted employee to be embezzling, so often it was because they had a gambling issue. And so there is a direct workplace connection.
Yeah, I'm happy to leave this off. This is 2 recovery-friendly presentations in a row where the first question was about gambling. So clearly, this is top of mind, and I really appreciate the question coming up. I'm a public health practitioner, right? So I think the first thing we need to do is raise awareness about the issue, because I think a lot of people don't understand that the gambling that they're engaging in on their phones or their family maybe could even be classified as an addiction. And so it's similar to when we describe what is a substance use disorder and we talk about mild, moderate, and severe. I think education and awareness is step 1, especially in tech and finance industries. I think are sectors where gambling is kind of part of the job description sometimes, or at least, moving money and et cetera. And so those are industries that I know organizations are paying a lot of attention to. We're aware that this is on the rise, right? With online gambling being legalized 7, 8, or 9 years ago. The forecast was at about the 9 to 10 year mark where we're going to start seeing a lot more of this really impact the workplace, and that is what's happening. We are partnered, or we're aware of an organization called Birches Healthcare. They do addiction treatment with certified addiction counselors specifically for gambling, and they are Medicaid covered. And so we're starting to share more resources in the field for human resource professionals and even EAPs in healthcare about having someone who specifically, from a provider, practitioner, clinician standpoint, is aware of that form of the disease. So we are talking about it. When we look at the Colorado Recovery Friendly Workplace website, it says for our definition, it's all things mental health and substance use disorder. It's a broad behavioral health definition. There are some states that include recovery from natural disasters, which clearly has a mental health element. And there are other states that are solely recovery from substance use disorder. In Colorado, it's recovery, including anything related to mental health and addiction or substance use disorder. And certainly eating addiction, eating disorders, gambling addiction, sexual function and pornography is part of this conversation as well. And many of these things are tied together. So getting people awareness and information is always my thought about the first strategy. I don't know, Claire or Brett, if you have any other thoughts about gambling, but as I mentioned, this is the first question, 2 presentations in a row, which makes me think it's really top of mind for everyone.
Yeah, I don't have too much to add to that. I think your answer was robust, David. I'll just share that I think most of the information and content that's out there in terms of building programs is really focused on substance use primarily at this point. And to David's point, these definitions all vary across different states and different initiatives. So I think it's a really good foundation for building in some of these broader applications for addressing addiction holistically, whether it's from substances or other things. But I think the programs that currently exist are strong on the focus on substance use and recovery related to substance use itself, to answer your question. But I do think that, this is an emerging topic area. And I think there's lots of things that we're still learning and lots of opportunities we have to build programs that address the need best for employees and organizations. So I think it's a really great question, something that we can continue to think on where it fits in best.
It's also important to note, and this is something that I found out as we share more information, gambling addiction is maybe the only of the addictive behaviors where the addict themselves thinks they can get out of the whole thing through one thing of the slot machine, right? It's I think those of us that use psychoactive substances, and the longer you get it, you kind of know what you're doing, and you kind of know where you're going with it, and it's not usually a great place, and we're kind of aware of that. Whereas and eating disorders, I think people understand a little bit too about what they're going on. I mean, sometimes there's some disassociation from it, and I am not a clinician by any sense, but gambling is the one. And I've had some people recently talk to me about, it's kind of like when parenting children and other things like that slot machine. If you hit it on one time, all the dopamine gets flooded in and it works. And you think, well, I'm now out of my doldrums because I hit the jackpot. And so it's a really tricky one to treat. And that's why having certified addiction counselors that are specialized in gambling, I think, is important, because it doesn't always act the same way on dopamine and in the brain as some of the other addictions that are based on psychoactive substances and even eating.
Very helpful. Thank you.
I see at least one question in the chat from Prince Kofi. Thank you for the question. What would make employers more willing to move from a punitive approach to a more supportive one? I love the question. We get this a lot. I think my first reflection on that question is, are employers really all punitive? We can't say that they are. Some are, for sure. So the first thing is recognizing and having awareness of, are we punitive? Is that maybe our policy is, but in practice, maybe we get people support and then we figure out what's going to happen. So the first thing is, where are we on that punitive to supportive spectrum, and analyzing, well, what do we really do? And so then we make a determination based on where we're at. Is this who we want to be as a company? Do we have core values about supporting employee safety, health, and well-being? And if so, are we living that value with how we approach substance use disorder? So I think the first thing is awareness of where are we? Are we punitive? Are we supportive? And why are we the way we're behaving? Some introspection. No right or wrong answer to any of those questions, by the way. And then secondly would be, okay, what's the result of where we are on that spectrum? If we're punitive and we're terminating people frequently because we're in a safety sensitive sector, maybe, and we're in a state where there's a lot of cannabis use, and therefore we're firing a lot of people. Is that good for our business, or is there other ways to approach this conversation, right? We know some companies who have shifted their policy specifically around cannabis to be much more about impairment than a visible impairment rather than what comes up on a drug screen. So, I think it takes data and awareness, like the NSC cost calculator, of understanding what is the issue of our workforce. It takes some introspection about where are we from punitive to supportive, and then it takes some collaborative conversation about what do we want to do with it. I think that's a bit of a theoretical answer to your question, but my first thing is I don't think all workplaces are punitive by any stretch of the means, and some of them are going to always be punitive, and I think we have to be okay with that too. That might not be the industry for somebody to work in. Claire, Brett, do you have any other question or comments on how to get employers to move?
Well, I'm going to throw something into this conversation again because it's just front of mind for me. I've done some contract work with a really cool recovery center out of Salt Lake City, Utah, called Recovery Ways, and they really cater to people in the trades. And as fate would have it, I was invited by them to take an individual from my neck of the woods who works for Amtrak to get on a plane to go down there. And so we had a really nice chat, as people in recovery tend to do. we tend to have a lot of fun sharing stories and talking and whatnot. And the thing that jumped out at me that speaks directly to this question is, though it was policy for this individual to have lost his job, in this case, there was some things that were done that there was some discretion. So that really surprised me because a company that large, I assume that once you get to that place where it's, you're on this side of the line or that side of the line, in this case, that wasn't true. And he was very optimistic about his future because of that. And he was taking it very seriously. And that was just really cool to be close to. So once Amtrak in this case decided that they were going to support this individual and get him to treatment down in Salt Lake City, yeah, he's, like David said earlier, we're kind of badasses once we get there, folks. And so, that's an investment that will probably pay off for that organization. So that's what I'd like to share as part of that.
We have time for probably one more question.
Anybody want to read that? It's a long one.
I can actually say it. So I'm new to the initiative. I'm training people. They love it. But then the follow up, now what? And we send the take 5 videos. And then I just found out that my treatment center that I work for has a program called Fresh Start with one mosquito control. So we send guys from our recovery housing, and they have a contract that they have to, with the mosquito control, they have to be engaged in counseling or recovery peer support. They can have random drug screens, and our agency supplies those. And it's kind of genius. And I want to try to figure out a way to offer that to some of our other RFWs that they kind of don't know what to do after.
Yeah.
Right. They don't have HR people. They don't have EAP. And so I just learned about this, and and I've got some that have gotten trained. We did a construction summit with 15. I had, Michigan Works was there and the U.S. Department of Labor. I mean, it was great, and they did it. And then now they're kind of like, I'm kind of bugging them. So let's finish up and let's look at your drug policy, so something that's not just like, okay, here's the training. Everybody loves the training. It's gritty. It's got substance. But how can I continue to keep them engaged so that they practice?
Well, in my mind, you already have the menu figured out, right? It's going to include policy review. It's going to maybe include a review of the medical plan and other benefits, talking to the EAP. So there's this whole thing about programming that you're going to want to evaluate. And we use an organizational survey in Colorado where organizations take this organizational survey and figure out where they are in terms of supporting worker mental health. And they take that annually with us. So we get a check-in each year. And I'd say it's not a one size fits all or a one time in place. And one of the knocks on some of the earlier recovery friendly workplace initiatives is people got the badge or the designation and then they never talked about it again. And times change, leadership changes, employee bases change. So having the training happen more frequently than one time in 1 year also makes sense. We're encouraging our employers to expand the reach of the training annually. So if they train their HR team in year 1, maybe they move it to all staff in year 2, or maybe they did leadership in year 1, it goes to middle management in year 2. If it's a really small business, maybe it's just a refresher course or bringing us in for a coaching or advising consultation on what is done. But it does require you as the program director to consistently be persistent about engaging the company and keeping the conversation top of mind, because those companies are going to go back to doing whatever it is they do, and they should. That's what their focus is. Your focus is on helping them sustain the conversation on recovery and supporting people in recovery on somewhat of a regular basis. And you need to have a menu of choices for them that they can choose from when they're ready to pick the next thing.
Okay, thank you.
We'll leave it there. Thank
Claire,
you very, very much to
one quick thing, Claire, can we put your link to your workforce wellbeing hub right about now? Is that cool?
Yeah, I'll put it in the chat.
Okay, super.
Thanks, Brett. Thanks, Claire. Thank you, David. I really appreciate you being with us today. Thank you to all who stuck with us and through the bumps in the road. We really appreciate it. And if you are interested to review what was presented today, in about a week, the recording for this event will be live along with the other 2 events that we hosted. I also have the slides, and if you want to have the professional development credit, just send me an email, springam@pdx.e or at ohsu.edu, springam@ohsu.edu. And we'll sign off. Thank you. Enjoy the rest of your day. We appreciate you.
Thanks.
Thanks, everybody.